Everything is changing, growing, and evolving, even you. From the nurse's student to the baby nurse, off the bedside nurse and into entrepreneurship, you have evolved. So now we're here at the Evolved Nurse Podcast. I'm your host, Lakeisha, and let's get right into the episode. Hey, y'all. Meet Jenna Perkins, RN WHNP, a board certified women's health and gender related nurse practitioner serving the DMV area. Jenna completed her BSN and MSN in women's health at the University of Pennsylvania School of Nursing. Her career as an NP launched in a busy downtown DC office where she became an expert in urology, GYN, sexual health, and pelvic floor disorders. She is a member of several professional organizations, a whole lot, y'all. She designed this practice to deliver quality care in an environment that prioritizes patient education, evidence based care. We know that we need that, and time. When she is not helping her patients heal, you can find her enjoying being a wife and a mom of two. Can we welcome Jenna to the Evolved Nurse Podcast?
Thank you so much, Lakeisha. I'm excited to be here today.
Yes, I am excited to have you. So, my first question on this podcast is always, did you always want to be a nurse?
I knew that I wanted to be what I call a healer. I didn't
Mm-hmm.
know that nursing would be that path, but I was raised by a healer. My grandmother was a reverend, so did a lot of what you would traditionally consider like counseling.
Mm-hmm.
And then also did, some work with some herbs and helping the girls out. So I kind of was raised by that and knew that I wanted to be a healer. And when I visited the University of Pennsylvania, I fell in love with the School of Nursing and nursing in general, just because of that school is just such a special place. So I didn't always know that I wanted to be a nurse. I knew that I wanted to heal people though, and so nursing is like obviously the right way to do it.
Okay, so what actually led you to determining that you were going to go to nursing school?
So I was applying to different schools and again fell in love with the School of Nursing, and it was at the University of Pennsylvania. And once I got accepted, it was like, all right, it's a no-brainer. Like I don't even need to hear any other acceptances. This is where I want to be. So
Okay. It is rare that you find a school that you're like, this is where I belong.
yeah, definitely rare. For me, my educational background, like I started out in Detroit public schools. And so you can imagine the struggles that come with being in a predominantly Black city and
Mm-hmm.
the public school system. So all the systemic racism that kind of bears its head when it comes to the educational system. So I was fortunate to get a scholarship to go to a boarding school,
Okay.
but was in the middle of nowhere and surrounded by people that didn't look like me. And
Mhm.
so just that culture shock really kind of sent me into a tailspin during my teenage years. And so when it came to picking a college, I knew that I wanted access to quality education. I wanted the best of the best. And so I was really just looking at Ivy League schools. But I also knew that I didn't want to be isolated. And I wanted to be in a place where I could look around and like see some Black folks. So I think Penn is great because it's, an Ivy League school, but it's also in West Philadelphia. So whenever I was feeling othered in the School of Nursing, I knew that I
Mhm.
could just take a quick walk down, Market Street and be in West Philly around the folks. So it really was a dream come true.
And I really love that for you because so many people struggle in nursing school because they are othered. They often feel imposter syndrome. They don't feel it's nobody else that looks like them in their class. And so for that to be an Ivy League school, I'm glad you were in a place where you could go and be like, oh, okay, let me bring myself back to my roots.
Right, literally, like let me find myself. So, and it was nice because I was able to form so many other relationships. Like, I joined a historically Black sorority, Delta Sigma Theta,
Okay.
and that was amazing just to have my girls with me, that kind of were in the struggle with me, as far as being one of a couple. So, Penn really did offer kind of the best of the worlds that I was looking for.
Okay. So you said that going to boarding school, being around people that didn't look like you, sent you into a tailspin. for the students who they haven't had the most linear journey, they feel like their lives are quote unquote over. What led you to changing your life?
Well, I mean, it's different when you're in high school because there's a finish date, right? Like
Mhm,
I was like, I'm going to graduate and I'm gonna get up out of here at some point. So um what led me to changing my life was really just trying to be tapped in with my purpose and knowing
mhm,
like I have a purpose. I know that I'm supposed to heal. I know I got to get through this part. So let me just set myself up for success and not failure. And again, like be in a situation where I don't have to be so concerned with the stress,
mhm.
the unnamed stress that comes along with like carrying that type of weight of being, the only black or one of two or three.
Yeah. It's always hard, and I always say that you have to recognize when you are a token so that you can deviate from the path of actually doing the same thing to other people.
Yeah, tokenism is interesting. I never really felt like a token. Like, well, I mean, I probably was though. They are looking for people to be on the front cover of the the magazine for your school. They're like, yeah, you come. Um, so for sure, there was a level of tokenism that was there. But I think because I had such the foundation of
Mhm,
my blackness, like in my family and my friends and my social groups, that I didn't really allow myself to feel like I was being used
mhm.
by other people, which I think was protective, honestly.
Yes, and I truly do love that for you. I think I recognized it when I was in high school, but of course I still had like my group of friends, the set people that, looked like me. We all were thriving in academia, but it was still like you kind of noticed the little things that says all of us are smart. Like I literally know people who probably were smarter than me, but they just didn't receive all the opportunities that I received. So that's when I was like, maybe this is what I'm going through here.
Right, right. It's so funny when people look at my story and they're like, wow, you must be so exceptional. And I'm like, okay, for every one Jenna, there are a bunch of other Jennas that are in the hood that just haven't had the opportunity to grow and to stretch themselves and to become who they were really designed to be. So very
Yes.
blessed.
So you decided to go to nursing school. Now you're here. What was your true experience in nursing school, like with testing and being able to maneuver through classes?
Yeah, Penn was hard. I mean, it's a tough school. I think the School of Nursing is probably one of the toughest schools in
Child.
the undergrad because like I was trying to balance having a social life and
Mhm,
finally getting out and being able to party and that coming of age that comes as you are 17, 18, 19 years old, but also having to wake up at 5:30 in the morning to be at clinicals by 6:15, which none of my friends were having to go through that. So it was a lot of growing up quick. I think
mhm.
is a challenge in nursing school. The testing and the academic work, it is what it is. You put your head down, you do the work, and you get through it. And I didn't find that to be particularly difficult. It's just the balancing act of it all. How do I have a social life? How do I maintain friendships? How do I stay connected with my family? How do I start to date? How do I do all of these things while also trying to become the best nurse and studying and
Okay. So you on balance, and that is huge in nursing. So most times people lean all the way to the opposite side. Like they don't have a social life. They're only in school, in the books, and they're struggling. How did you maintain having a friend group?
I would say that it's easy when you're in college, at least the situation that I was in, because
Mhm.
we lived next door to each other. So
Okay.
the friendship maintenance that has to happen now, where I have to like pick up the phone and call somebody or drive, a half hour
Mhm.
to somebody's house or even a few hours to get to a lot of my friends now, I didn't have to do that. I was living with them. They were my roommates, they were my sorority sisters. And so the situation just made it a lot easier to maintain those friendships. But of course, everybody doesn't go to nursing school in that traditional undergrad experience way. But I think you just have to make it a priority and recognize that, like, for me, friendships are essential to
Mhm.
how I like fuel myself, right? Like, I have to stay connected with my girls, I have to be connected with my friends to remember who I am, right? Because they serve as like a reflection of who I am. So
Mhm.
it was a priority to maintain those things while still going through the grind and like hustling in nursing school. And it served me well, like being able to have those relationships extend until present day, where now, my kids are friends with my friends' kids. So,
That is so beautiful.
mhm.
So I love that you were extremely intentional about your friendships. So to the students that are listening to this who feel like you can't have friends right now, you have to be in the books, it is essential that you have time for yourself, because if you dedicate all your time to nursing school, it will burn you out. I've seen at the end of nursing where a nurse actually said, "You know what? I don't even think I want to do this,"
Mhm.
because you lose yourself, like you said. You don't have friends anymore because, of course, your career is important, but it's not as important as creating those intentional relationships within your friend groups.
Yeah, but I think you also have to be very picky about who your friends are.
Mhm.
So when you're doing something like going to school for nursing, you're leveling up. And so if you are hanging on to friends who are not also in a growth season, who are not
Mhm.
also leveling it up, they won't understand it. They won't understand I can't hang out tonight, I got to be up early in the morning. They won't understand, yeah, we can hang out, but let's study together, right? Like
Mhm.
a lot of those friendships were maintained with study groups. Okay. Like if I'm pulling an all-nighter, we're pulling an all-nighter. So,
Yes.
just making sure that like your friends reflect who you are. And so if you have friends that you feel like they're holding you back and you have to cut everybody off, that might not be a bad thing. Okay, go ahead and cut them off, but also find new people that are better aligned with where you are going and where you are now so that you can still have you got to have some sort of relationships.
Yes. I love that you said all of this, because even in nursing school for me, like, my friends were also my roommates. So it really made it easier for us. And one of them was in school, like on her way to PA school, and then one of them, she worked for the Department of Ag, but at the end of the day I still had community.
Right.
And
Mhm.
so it's important for you to have community with like-minded people.
Definitely. And don't be afraid to level up and recognize that, like, yeah,
Mhm.
you're gonna lose a couple people on your way up. But that's okay. You'll
Mhm.
be blessed with different experiences, different relationships, but just be open to it. Don't put your head down and say, like, I'm gonna do this by myself, because you're gonna burn out.
Oh, and it is easy to burn out.
Hmm. Hmm.
So you made it through nursing school, maintained friendships, passed your classes, now you're in the workforce. What did your initial entrance into nursing look like?
It was very interesting. I actually, as an undergrad nurse, did some research on HIV, HPV, like prevention work with
Mhm.
one of my mentors, and kind of got exposed to the world of sexual health and HIV work, infectious diseases. So when I graduated as a nurse, I knew that I wanted to go to nursing school and that ultimately I wanted to design a practice like the one that I have today.
Mhm.
So I was like, I don't really want to do bedside. So I went straight into being a clinical trials coordinator, where I worked on trials that were looking at a functional cure for HIV, so some gene
Mm.
therapy. And so, yeah, I went straight into that. And then after doing that for a couple years, went back to school for my women's health and gender related degree.
Okay. So I am so surprised, because this is the first time I've actually spoken to a nurse researcher.
Yeah, we're out there. And most nurses, you come out of school and you feel like you have to do the bedside, like you have to do the track that's kind of been laid out in front of you. And again, like the vision has been clear for a very long time. So I was like, that seems stressful. Like
Okay.
I do not
Very
want to
stressful.
I do not want to do bedside. So how can I use my talents? And how can I gain more skills? Like what are the skills that I need? And so research just was easy for me because it was a continuation of the work that I was already doing, but I knew that it would grow me in a way to be more independent. And it really did. So I'm super grateful for it.
Okay. So having the HIV, HPV research is what led you into deciding that you wanted to do women's health, right?
Yeah, definitely. I found that there was a lack of care for specifically for Black women around HIV. Like we knew
Mhm.
the numbers were high, but even when I was doing the research trials, like a lot of the studies that we were doing were seeking out, homosexual men, gay
Yes.
men. And I'm like, okay, well, what about all of the like straight Black women who are also disproportionately affected by HIV AIDS? Um, and then I started to do some work on the HPV piece of it too. And so really that was like, okay, I'm fast tracking it into women's health. And I'm a woman. I'm a girl's girl. I love my sorority sisters. I love myself. I love, I was raised by, I had a bunch of aunts always in the house. And so I knew that I wanted to have women's health be a part of my practice. So I'm very fortunate to be able to be doing this work now.
And just from a personal standpoint, around the age of 5, my mom had to tell me that my aunt had HIV.
That's a heavy
And
diagnosis for a kid to learn.
yes, and it and it was stemmed off of, I think me and my aunt were walking down the street and she had a popsicle. And this is before, like, because we're disenfranchised. I'm from a impoverished area. And so they don't really know the route in which you get it.
Mhm.
And so I asked my aunt for a piece of her popsicle and she tells me no. She always gives me everything. So now I'm like, why won't you let me have it? And so my mom at a very early age had to sit down with me and tell me the why.
Mhm.
And so around 9 or 10, she passed away. So that has been something that I have been like researching and trying to figure out for a very long time. And even now, when we see the commercials of HIV and AIDS or the PrEP, it's always rooted in biases that
Mhm.
it's a homosexual disease.
Mhm.
So there is a narrative that has to be changed. It's sad that it still remains the same across the board. Like they might add in one person, like one person of color, one woman,
Mhm.
but normally these commercials that we're seeing, excuse me, are saying that this disease is synonymous with this group of people, and that's not okay.
Yeah, definitely not okay because it leaves Black women like your aunt who have the positive diagnosis feeling like they're alone, like,
Mhm,
oh, well, it's just me. And we know that that's not the truth. We know that, the fastest HIV rates, the last time I looked, was growing in the Black straight female population, right? Especially women who have been touched by the incarceration system. So,
mhm,
either with a partner that has been in prison or more specifically with their own exposure to being incarcerated. So we know that that is not true, that Black women are not just like not being touched by HIV/AIDS. We know that we are definitely being affected and being affected disproportionately. So it is sad to see when we have these new medications. So PrEP was one of the trials that I did um, while I was spending time as a RN during the
mhm,
clinical trials research. And so to still see that like the uptake of PrEP is going to be correlated with the media, right? So like
mhm.
who's talking about PrEP? What spaces are we talking about PrEP? Not the OBGYN doctors, right?
Exactly.
OBGYNs are not trained in PrEP. The companies are not approaching OBGYNs to talk to their clients about PrEP. So it's still like all of the resources, the marketing dollars are still very much all about like homosexual white men specifically. But we know that that's not the case.
Mhm. So, since you have had the clinical research background in HIV, HPV. What are some resources that you recommend for people who are living with HIV?
Living with HIV, I think it's going to depend on where you are geographically,
Hmm.
honestly. So, like finding the hub in your area. So, we're here in the Metro DC area. So, there's Whitman Walker, again, a space that is mostly associated or connected with like gay men.
Hmm.
Um, but I think that that is a challenge where if you are a Black woman, how can we create more spaces where we are at least having conversations around HIV? But it's gonna definitely depend on like where you are geographically to figure out where the resources are.
And then we also have to destigmatize sexual health diseases as a whole so that people feel comfortable coming forward and being accepted into these spaces.
Definitely. So a lot of my work right now is around sexual health and specifically sexual pain. And I think the skills that I got as an RN being able to talk about HIV, which is, one of the most taboo things to ever talk about,
Hmm.
it was very easy for me to talk about women's health issues in general. And then when it came time to talk about like orgasms and pain and pleasure, I don't feel no type of way about talking about that. It's like okay, if I could talk about AIDS and HIV, then I can talk about orgasms. That's a no brainer.
Okay, so now you've started your practice, right? And you just said that you focus on sexual health and sexual pain. Let's
Yes.
talk about pain.
Okay, let's do it. Yeah. So, what do you have a question specifically, or you want to kind of hear my little spiel?
Give me your spiel and then I'll double back.
Okay, cool. So when it comes to pain, it is very common but not normal. And when I'm saying pain, I mean like pain with intimacy. So penetrative, penis and vagina sex is what most people traditionally think of. But it could also be pain with trying to put a tampon in, or pain with fingering, or sometimes even just pain with sitting for long periods, right? Like pelvic pain is something that is extremely, extremely common, but not normal. And so when I think about pain, I think about what I call the big three. So there are the muscles, which typically is because muscles are tight. So tension and tightness in muscles leads to dysfunction and pain, lack of blood flow. So muscles is one, and then number two would be hormones and tissues. So things like menopause or even birth control use can suppress the amount of estrogen and testosterone that you have available to the bladder, that is available to the vagina, and it can really set you up to have dryness, rawness, pain, especially if you're trying to have any sort of penetrative play. And then the third option, or the third kind of culprit for pain, is nerves. So, do you have a hypersensitivity? Were you born with more nerve endings than the other people? Are these other two influences of muscles and hormone conditions or tissue issues causing your nerves to be hypersensitive? And so, really, those are kind of the big three that I'm thinking through when I'm trying to treat
Mhm.
pain. Are your muscles tight and tender? Do you have dryness, and what are your hormones like? And then finally, what are your nerves like, and how can we make them not so sensitive?
Okay. I asked this question because I've noticed men's conversations around sex.
Mhm.
And when they're speaking about it, they say things like, yeah, I want to quote unquote beat it up or pain her, all of the things that should not relate to sex.
Mhm.
It go ahead.
Well, that's what you see in the movies, right? Or what
Yeah.
you hear. And so, because we don't really have good examples of people who have been given good sexual health knowledge, we don't really have good leaders in the space. And so we just, generation after generation, repeat, kind of what we hear because we think that that is normal to like beat that, beat the P up. I don't want to curse on your podcast, but
Yeah.
um, when in reality, like women don't want that. Some women do, right? Like if you are into pain, then great. But really, I'm talking specifically about the women who are distressed by their pain. They are bothered by their pain. It is not a
Mhm.
kink. It is not something that they are into or that they like. So yeah, I mean, pain and pleasure, they run along the same nerves. And so there are some people that will have some pleasure from like painful, intense experiences. But if it is constantly painful and you are getting no joy or enjoyment out of it, then that deserves to be treated.
Yes. So I have a question because I'm now working in the pediatric OR,
Mhm,
and I have seen things that I normally see in older women happening in younger women.
mhm,
Where they are having ovarian cysts that make them look like they're 8, 9 months pregnant, but they're afraid to come in because they actually feel like they're pregnant.
mhm.
Like they're seeing the changes in their bodies and they're afraid to go to their parents. What age demographic do you serve?
Yeah, so I see mostly adults.
Mhm.
Very rarely I'll see adolescents or like teenagers. Typically that's when people want to like the mom is maybe seeing me for perimenopause and she's like, "Hey, I got a teenager. I want to have her first exam with you so that it's not traumatizing, right?"
Mhm.
Um, but typically I'm seeing adults who have pain or bladder issues, really the most intimate things that you don't have time to talk about in a OBGYN visit. Those are the things that I love discussing.
Okay. Look, you have a very unique practice.
Yeah.
Very unique. I've never seen anything like it before, and I've never seen it from a woman who looks like me.
Mhm. Yeah, thank
So
you.
So tell me what it looked like going into entrepreneurship.
Yeah, so I always knew, not always, but I knew from a very young age that I wanted to create this space. Again,
Mhm,
like God kind of put the vision in me. So I knew that this was what I was working toward. When I made it to DC and I started working in urology, so I had this GYN training, this infectious disease background, and I started working in the Department of Urology, essentially because they were like, okay, listen, you know the anatomy, like
mhm,
you can see all these women that are coming in with these recurrent UTIs. And I was like, great. Um, and so that led into more of the sexual health stuff and doing some menopause work because hormones are foundational for everything. And so I was able to grow and really go deep in the places that there are gaps in traditional women's healthcare. So bladder concerns, sexual health concerns, pain concerns, really where again the traditional OBGYN visits fall short because they don't have time, you know.
yeah,
So I had amassed these skills where I'm doing, you know, very complex work, deep work. But guess what? It's not that complex when you really look at the patient in front of you because the same woman who's needing the urologist is also the same woman having painful intercourse, is also the same woman having general pelvic pain, you know,
mhm,
also the same woman who's going through hormone conditions like perimenopause and menopause. But it got to a point where I felt like, okay, I have amassed all of this learning, I have all of these skills, and I have this vision in my back pocket, and I'm not acting on it. So, God, like,
mhm,
what am I doing? You know? Um, and I was at a place, the academic center, where I was surrounded by so much talent as far as the providers, but so much dysfunction when you work in these big healthcare systems, you can't change things easily.
mhm.
So me wanting to like treat women for their UTIs and their menopause and their pelvic pain and their sexual health, you know, it got to the point where it's like, no, 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 you know, you're kind of doing too much. I need you to see as many people as quickly as possible.
Yes.
So I was like, okay, you know, the time is coming. But really, the thing that happened was I had two babies fairly quickly, you know, close to each other. They're exactly 2 years apart. Um, and COVID happened. So in 2019, I had my first, got back from maternity leave with her, and then here comes COVID. And then got pregnant again. And in 2021, when I had my second baby, when I went back from maternity leave, it was like, okay, the world is different. Healthcare is changing. People are doing telemedicine.
Mhm.
And so kind of getting back into the swing of things and being met with resistance for things that I felt like were very simple, like let's do some more telemedicine, you know. I was like, okay, it's time for me to get out of here. I think I've kind of worn out this season and
Mhm.
now it's time to really act on the vision that God's given me.
Oh my goodness. Now that is very powerful because a lot of us don't work within our purpose
Mhm.
because we have seen the vision, we know what it is, but we are afraid
Mhm.
of what it will look like on the other side.
As you should be.
Cause look, so what struggles did you have like starting your business?
Oh my god, I went into it fast and furious. I did not plan to do it so quickly. I
You
really
looked up and you were there.
I looked up and I was like, "Okay." No, I really was like, "Hey guys, I wanna give you 3 months and I wanna, like, help train someone, and then I wanna slowly transition and open up my own practice." And they were like, "Girl, you either is with us or you can give us 2 weeks and be out the door."
Mhm.
And so I took the 2 weeks and, like, very quickly I had to be like, "Okay." I looked for other jobs. I had a couple other job offers and eventually was like, "What am I doing? I don't wanna be there because I don't wanna work for people, so why am I applying for other jobs?" And so I just kinda jumped in with both feet, and God is so good to me that one of my really good friends who also does sexual medicine had a practice in Alexandria where I live,
Mhm.
and had space open and was like, "Hey, you're starting your practice. I have space if you want to rent from me." And I was like, "Okay, well, that seems like a layup, God. Like, yeah, I might be on the right track." And really, all of my steps have been ordered since that time. Once I really decided, I made the decision that this is what I'm going to do, then God has been so, um, just like responsive to my request, to my steps, like, okay, here's the next thing. Go.
Passing you the torch like you running in the Olympics. Shout out to the
Mhm.
Olympics.
Mhm. Right.
But I'm over here about to cry because
Oh.
I am so glad that there is a woman in the space that women need. Like people need people like you because having having issues with sexual health, urology, pregnancy that leads to pelvic disorders. I'm so glad that you decided to actually follow the steps.
Thank you. Thank you so much. And every day I wake up and I'm like, am I doing the right thing? you
Mhm.
know? So if there is a baby nurse out there or even a seasoned nurse who's thinking about entrepreneurship, like just know that it's going to be second guessing. Like even at 2.5 years in business and doing objectively well and doing amazing work, I still am like, God, really? This is what I'm supposed to be doing? This is hard. Why is it
Yes,
so hard?
because you're everything now. You're your boss. You have to drive yourself. Like it's not a day that goes by that you can look to somebody else to tell you what you should do.
Oh my God, no. And it's so easy. As nurses, like we're used to, okay, here's the order.
Mhm.
I'm gonna do it. I'm gonna do it, and I'm gonna do it well, right? Like I'm really good at that. Give me the steps, I can execute. But when it comes to being a visionary, when it comes to
Mm.
like having the vision and bringing it to life, that's a whole different set of skills that we haven't necessarily been trained on. Like that's not what you were being taught in clinical. So, it's been 2.5 years of really stretching and growing. And it's like a whole nother degree in entrepreneurship and how to stay focused and stay committed and not let the bad days outweigh the blessings.
Yes. Oh my goodness. Look, Jenna. So, do you also have someone else working with you within your practice, or is it just you?
Yeah, it's mostly me, but I do have
Mhm.
a team. I have two virtual assistants who are great, and they help me with all of the day to day administrative work. And then I have a couple of nurse practitioners who are contractors who help me with some of the procedures and the visits. And definitely looking to grow. Just trying to get my panel kind of at its max before I bring on other nurse practitioners who are committed to the vision.
Okay. So, to the baby nurses and the veteran nurses, you see that she went from being in a clinic, not knowing if that was something that she wanted to do, also going into like working with her friends so that she could understand the ropes of having her own practice. Now she has her own practice and has a team.
Mhm.
My goodness.
When you lay it out like that, it sounds really good.
I mean, when you're in the midst of it, it's easy to forget who you are
Mm, mhm.
because you don't see yourself the way that others can see you.
That's true. That's a word right there for sure.
Yes. So we are ending this episode. It does not seem like we have been on for this long.
I know, I know. But this has been great.
So, what is one thing that you can, one quote or piece of advice that you can give to new nurses?
Nursing is beautiful because you can do so much with it. You know, you don't have to just be at the bedside. You don't have to be a nurse practitioner. You can be an entrepreneur. You can be anything that you want to be. Nursing has a path. And if it doesn't, you can create it.
Okay. Yes. Y'all really take that in stride because it's so easy to get bogged down in going to med surge because your clinical instructor and your teacher may tell you that is where you need to start. But you see her path is not linear, just like so many other people on my podcast, their paths have not been linear. So it is very, very imperative that you decide, you know what, if I don't want to do this, I don't have to. It's so many other areas that you can go into.
Yep.
With that being said, is there a particular book or something that led you to be able to feel great about yourself and going down this path?
Ooh, that's a great question. A couple of books. Let me think about it. I read the Tao Te Ching whenever I have a free moment in clinic. And so it is like an ancient Buddhist text,
Mm-hmm.
and that is something that I find grounding. I've been reading it since high school, actually. And so I really like to just crack it open and see what comes to me. So I actually have it right here. So let's see. Um, this excerpt is number 49. It says, "The master has no mind of her own. She works with the mind of the people. She is good to people who are good. She is also good to people who aren't good. This is a
Mm.
true goddess."
I love that quote.
Yeah.
That is beautiful.
This is true goodness is what it says. I misread it, but yeah. So and that was just so I like to do that. I just like to just if I'm feeling kind of low, crack it open and see what the day is serving.
Okay. So, what are some things that you have coming up in the future?
So lots of things. We are reworking our website, discoverhealth.com, DISCOVHER health.com, and adding even more resources there. So we have lots of like free downloads currently, and we'll be adding some more. I have an event. I've been doing lots of workshops in the area. I love to do speaking engagements. So on August the 24th, I am hosting a perimenopause and hormones 101 talk at a local spa here in the DMV called Valley on Springs. So I'm very excited about that. And yeah, just trying to keep my head down and heart happy and keep serving the people.
Okay, where can they find you?
Yeah, so I'm on social media at Discover Health, DISCOVHER Health. And you can find me on Facebook, Instagram, TikTok, all of those.
Okay, so if you have made it to the end of this episode, thank you for listening. She gave us a wealth of knowledge, and we truly appreciate her for coming on to the podcast because she didn't have to come on here, but she did. So, with that being said, if you have any questions for the next podcast, you can email us at theevolvednurse@gmail.com. Also, you can follow us on The Evolved Nurse on Instagram. And you all have a great day.
Thank you.